Hello, my name is Kelsey Olson, and I'm a traditional BSN student at Nebraska Methodist College. And this is my final capstone project, The Educated Citizen. The public issue that I chose to address was lack of mental health resources locally here in Nebraska. I found many shortages of providers and resources here in Nebraska. In Nebraska, there is only 8 psychiatrists per 100,000 people in urban areas and only 3 per 100,000 people in rural areas. The average in the United States is 14 per 100,000 people. This puts Nebraska at a disadvantage for providers. This results in a lack of resources and an increased number of individuals who suffer from mental illness but cannot receive care. I chose to address this issue because I myself have faced many mental health issues in the past, and I was lucky enough to have the support behind me to receive treatment and care as needed. And many others here in the United States and Nebraska face many adversaries to receiving care, whether it be or access to resources or even providers in the area, and I think that needs to change. Firstly, an effective communicator uses critical thinking to generate, connect, and organize ideas in a written, oral, or nonverbal manner. The first experience I had with this was a medication pass at the hospital. This was my first time completing a medication pass at the hospital with a real patient. Of course, I was nervous and was scared for what was to come, but I was able to effectively explain what I was doing, what each medication was for, and why my patient was taking them. This was incredibly important for me building upon further in my nursing career and fully having an understanding of different medications and being able to explain what they're for each and every patient that I continue to take care of. To apply this to mental health care is during treatment of any mentally ill patient. Many of these patients are at risk for non-compliance with their medications, and this can result in unsafe situations for the patient or other people around the patient. So being able to explain why it is important that they take this medication and what it is doing for them can have dramatic effects on their daily lives. The second setting I was able to show effective communication was an ICU setting. We arrived in the ICU during a peak COVID time. It was super difficult for us to see as nursing students because it's a completely different world. But I was able to observe a family meeting of a patient's family who the patient was dying, and there was really nothing else we could do for them. And so being able to listen in on that conversation was super important for me. I learned how to hold a family conference and how to effectively relay important information in ways that the family could comprehend. Making sure that they comprehend and have as much knowledge as they can about the situation going on is super important in order for them to make an informed decision. We don't want to force any family to make a decision that they're not comfortable with or don't fully understand, so making sure that we address that in a family conference is super important. Applying this to mental health, family conferences for those seeing the effects of mental illness, whether it be a spouse, whether it be mom or dad, whether it be a kid. That's super important to be able to relay new information to these families and let them know what they're going to expect. Let them know resources that are available for them and whoever they're trying to help. Family conferences can also be super important for those who are newly diagnosed and navigating a new life. These patients, when they get a diagnosis, it can be very life-altering, and the changes that they have to make are just super difficult. So having resources available like support groups and therapy and stuff like that be introduced to them in a family conference is super important, and you must be able to effectively communicate that to reduce the level of stress coming from family members or the patient and stuff like that. Secondly, a reflective individual routinely engages in habits of inquiry that influence ways of thinking and actions. My first experience with being a reflective individual was at a hearing screening. I attended the hearing screening and initially had biases that allowed me to think it would be boring and not important to my nursing career. After attending, though, I was able to understand why these screenings were important. We learned from the get-go that screenings are super important in preventing health problems and allows us to provide treatment as soon as possible. So at first, something may seem like it can be unbeneficial, but usually it is for a purpose. And I truly learned that throughout this process. And I also learned that I should take advantage of every opportunity I'm given. Especially during COVID, we had limited access to clinical sites and other things. And so being able to have the opportunity to provide these screenings for the kids was super important. And I'm glad that I was able to see that. This relates to mental health because, I saw how my biases affected what I thought about the experience. It allowed me to see that even something as small as screenings can hold so much importance. And without them, people can fall through the cracks and fail to receive. This is the same for people facing mental illness. If we don't provide resources and care for these patients, like they have nowhere to go, and it just increases the amount of people who are suffering silently, and it just increases the bad effects of mental health, like suicide and other things that relate with mental illness. So being able to understand its importance of screening and providing clinics and um, increasing the amount of resources that we have in the community can really have an impact on the patients seeking mental health care. Secondly, I had the opportunity to attend Omaha Corrections. I was very overwhelmed with thoughts of what could go wrong instead of what I could learn from this experience. Originally starting out, I definitely was very nervous to interact with the patients. Um, as I went through the experience, though, I was able to see how biases affect the care that we give and can impact patients in a negative way. In the beginning, I was, nervous and didn't really want to interact with people. And throughout the process, I realized that these are still people and everybody deserves care. So, understanding what I could learn from this was super important for me and this experience. I learned how biases affect our patients and saw limitations to providing care with biases present. In the beginning, I was performing cares with biases present and wasn't providing the full amount of care that I possibly could. Um, and with mental illnesses, biases is one of the many reasons that we have such a lack of mental health care resources in the United States. If we can identify biases that we possess beforehand, we can prepare to care for those who are in serious need of someone to listen and provide resources. The more that we understand mental illness and the more that we talk about it, it kind of erases that stigma against it, and it's super important for us to be able to talk about that and be able to bring ideas and resources to government officials and seek that change is super important. We really just need someone to listen to these individuals and really fight for their care. Lastly, a change agent uses the disciplines of the liberal arts and sciences to analyze historical and contemporary situations and systems to develop cultural competence and to take appropriate initiatives to effect change. The first experience that I had was an eye screening. I participated in doing eye screenings at an elementary school where I was able to observe teachers and instructors adapt to the students who had disabilities. For this particular experience, we needed the students to look directly into our devices in order to accurately screen their eyes. Many of these students with disabilities came in, and it was a lot harder for us to get them to look directly at the camera and focus for the amount of time that we needed it to. And we had to use critical thinking skills that adapted to change. And this ended up creating a successful experience for these children and provided necessary care for these children. If we would have just given up, we wouldn't have been able to get some of these children the resources that they need. Some parents, especially with children with disabilities, overlook small things as eye screenings because they're focusing on such a big picture. So being able to narrow down eye screenings for these kids was super important. Um, the same critical thinking skills can be adapted for treating those suffering with mental illness. We have to fight every day with patients to develop trust and understanding and just developing these new ideas around mental illness and being able to find ways and create change in an atmosphere for the patient to trust you and their care team is super important because if they don't trust you and they don't understand what's going on, then they probably will not return for care. And that just creates another individual that is not seeking the care that they need and it's not available to them. So making sure that we find ways to adapt to each patient and find ways to help them understand what's going on and help them build trust with us is super important and is a much needed change in our society. Lastly, I was able to complete a windshield survey and a community resource hunt, which allowed me to understand the different cultures that are present in my community. The first step in culturally competent care is understanding what biases you might possess or what your culture is. And I was able to learn what culturally competent care was and why it's important to implement into our care. Understanding why patients do things differently than other patients and seek care differently or family structures are different, and what biases may be present for that patient or things that are preventing them from receiving care is creating boundaries and limitations for these patients. And the same thing goes with mental health care. Many patients are at a disadvantage already and have faced many adversities to be receiving the treatment that they are. So understanding the boundaries that these patients might have and the biases that are preventing them from seeking treatment. Maybe they themselves don't believe that mental illness is super important or mental health is super important, may have more trouble seeking out care. So understanding those is super important with mental illness. It can also expedite their care, finding ways that work in their lifestyle, work with their families, is super important with them coming back for care and continuing their treatment. Over the last 2 years, I have had an abundance of experience that have shaped me as I move forward with my nursing career. I have the confidence that I will be able to work as an RN, and I know that I possess the skills of being an effective communicator, reflective individual, and a change agent. And I know that will allow me to be successful and continue to build upon my knowledge, which is the most important part of nursing is building your knowledge and working for your patients and continuing care that you're proud of and every patient appreciates and working with change and adapting. And it's super important for me as a new nurse to remember those traits and remember why it's important to possess all of those. So, thank you very much.